muscle that does not develop from somite? Which do you think is the right answer? Option A, B, C, D. Yeah. Very good, Dr. Esther. I saw you writing the option C. Okay, now we'll identify the muscles right now. What is A? From the hyoid going towards the tongue. That is hyoglossus. It is easy to identify, okay? From the hyoid to the tongue, sides of the tongue, vertically oriented. B, can you tell me what is B is? This fan-shaped muscle going from the superior genial tubercle towards the tongue. Very good. Yes, Shiba Priyadarshini, that is genioglossus. What is this muscle here? Coming from the inferior genial tubercle down, but it's not labeled here. Below the genioglossus will be geniohyoid. Now C, what is C? This is your palate, right? Hard palate, soft palate. From the soft palate, from the undersurface of the soft palate to the tongue, that is your palatoglossus, right, Sangeeta? Palatoglossus, okay? And lastly, option D, this is the styloid process. From the styloid process to the tongue, that will be styloglossus. Okay, so now A, B, C, D is okay. Any other muscle that you'd like to identify, which is not labeled here? Can you tell me what is this muscle? What is this? From the styloid to the hyoid bone, this will be stylohyoid. Yes, doctor, right. And this one going here behind the stylohyoid, can you make out the margins of this muscle? This will be stylopharyngeus, right? Any idea what is this muscle? Come on. Originating from the hyoid bone going backwards. Yes, that is your fan shaped, right? The middle constrictor. Yeah, and this one here high up should be superior constrictor. Okay, so happy you're able to identify all the muscles in this image. Now coming to the question. So we know that all the muscles of the tongue are supplied by hypoglossal nerve, right? Except palatoglossus. I'm sure all of you will be knowing this. The only difficulty is identifying palatoglossus in the image, right? This palatoglossus is going to be supplied by pharyngeal plexus. Pharyngeal plexus is contributed by 9th nerve, 10th nerve, and the cervical sympathetic fibers. There was a previous concept that the 11th cranial nerve contributes to it, but Gray's Anatomy has changed it, okay? Telling that the 11th cranial nerve has only spinal component. Okay, now coming to the development, all the muscles of the tongue, which are supplied by hypoglossal nerve, they develop from occipital somites, myotome of occipital somites. Why palatoglossus alone not supplied by hypoglossal nerve? Because it's not going to come from the somites, okay? Rather than it's going to develop from the pharyngeal arch derivative, which it's a muscle of which arch? Supplied by vagus, the 4th and the 6th pharyngeal arch, remember? Okay, so it's going to be developing from the pharyngeal arch, okay? The 4th pharyngeal arch. Now, yes, we have identified all the muscles: hyoglossus, genioglossus, palatoglossus, styloglossus. This is your styloglossus, okay? So the muscles of the tongue can be divided into extrinsic and intrinsic muscle. Extrinsic muscle, they alter the position of the tongue, okay? Intrinsic muscle, they alter the shape of the tongue. Genioglossus is called safety muscle of the tongue. Why? Why is genioglossus called safety muscle of the tongue? This genioglossus, it originates from the, yes, genial tubercle, inserting the tongue from the root to the base. Okay, When it contracts, it will pull the tongue outwards. When the right genioglossus contract, it will pull the tongue out and the tip of the tongue will turn to the opposite side, okay? And it prevents the tongue from falling back. That's why it's called safety muscle of the tongue. Chondroglossus is nothing but the detached part of hyoglossus. Okay, palatoglossus will pull the tongue upwards. Styloglossus will pull the tongue backwards. Intrinsic muscles of the tongue is, of course, you have to know its name because in an image-based question, you can get that, okay? There's another picture coming. This is your superior longitudinal muscle. Here, lower down, this will be the inferior longitudinal muscle. You have the transverse linguae muscle and the verticalis linguae muscle. All of them again supplied by hypoglossal nerve. This I told you, all of the muscles of the tongue are supplied by hypoglossal nerve, except palatoglossus, supplied by the pharyngeal plexus, contributed by 9th, 10th, and cervical part of the sympathetic chain. Injury to the hypoglossal nerve causes ipsilateral atrophy of the tongue of the same side. And in hypoglossal nerve palsy, when the patient is asked to put the tongue out, the tip of the tongue will protrude to which side? To the same side. Okay, please remember that. Okay, this is another important image-based question. The superficial relations on hyoglossus. Okay, now, which of this has been asked recently in your NEET-PG question? Okay, NEET-PG, yeah. So, yeah, what you see here is again the muscles of the tongue with the relation on hyoglossus. Can we identify the muscles first? The question asked is, which of the following nerve is frequently injured during surgery on submandibular gland? Okay, A, B, C, D. First, we'll orient to the muscles in this picture. You'll tell me, okay, what is this muscle? Anterior belly of digastric. This one, posterior belly of digastric. Okay, what is this muscle here? This is mylohyoid, right? What is this which lies on the superficial surface of mylohyoid? The superficial part of submandibular gland. The mylohyoid muscle divides the submandibular gland into a superficial and deep part. Okay, beneath it you get to see the deep part of submandibular gland. Okay, this muscle you're familiar with, right? The vertical one, hyoglossus. And this one, yes, styloglossus. Now you can tell me what is this muscle fanning out from the hyoid backwards? The middle constrictor. This one, stylopharyngeus. Okay with the muscle? Anterior belly, posterior belly, mylohyoid, hyoglossus, stylopharyngeus, styloglossus, middle constrictor. Now coming to the nerves, I'll rub off the muscle name. Coming to the nerves that you see in this picture, okay, this one is hypoglossal nerve. This one supplying the mylohyoid nerve to mylohyoid coming from inferior alveolar nerve, that's a branch from mandibular nerve. Okay, this one accompanying the stylopharyngeus and supplying it will be glossopharyngeal nerve. This one winding around the submandibular duct from which the submandibular ganglion hangs out, that's the lingual nerve. So what do you think is the right answer for this question? The nerve that is frequently injured during surgery on submandibular gland? Option? Yes, very good. Option B, okay, the lingual nerve. The lingual nerve, it presents a triple relation with the submandibular duct that you see here. Initially, it is above and lateral. Then it winds around its lower border, ascends medial to it. This we call it as triple relation of lingual nerve to the submandibular duct. Any idea what's the other name for submandibular ganglia? It is also called the Langley's ganglia. Okay, this is just for interest sake. So there's a similar picture, but what do you see here? The hyoglossus muscle has been removed. Why? To show you the second part of lingual artery. This point I forgot to tell you. The lingual artery coming from the external carotid artery is going to be divided into three parts by hyoglossus muscle. The first part lies proximal to it. The second part goes beneath it. And the third part ascends along its anterior border. From the first part, you get the suprahyoid artery. Very easy to identify hypoglossal nerve here because it's accompanied by the venae comitans. Okay. From the second part, you get the dorsal lingual branches. And from the third part, you'll get the sublingual branch. Okay. Yes. Again, another image showing you the muscles of the tongue. Okay. A coronal section. The pointed structure innervates which of the following muscles? Yes. So this picture is just to show you that the lingual artery is divided into three parts by hyoglossus muscle and branches from each part, right? The pointed structure in this given image innervates which of the following muscle? So what is this bone that you see here? Mandible. So you must have known about the mandibular foramen in the mandible, inner surface of the mandible. What enters the mandibular foramen? It's not the mandibular nerve, right, Sangeeta? That's the inferior alveolar nerve and vessels there, right? So what are the muscles supplied by inferior alveolar nerve? It gives the nerve to mylohyoid that supplies mylohyoid and anterior belly of digastric. So can you identify mylohyoid here or anterior belly of digastric? Can you tell me the answer? What is A, what is B, what is C, and what is D? Yes? So the tongue is divided into two halves by a median fibrous raphe, right? Immediately on either side of the midline, what you see here will be genioglossus muscle. Okay, stay with me. This point is very important. On either side of the median raphe, what you get to see here is genioglossus. Then this will be the inferior longitudinal muscle. Inferior longitudinal muscle. Just lateral to this will be your hyoglossus. And lateral to hyoglossus, this will be styloglossus. So in a coronal section, this is the order from medial to lateral. Okay. On either side of the midline, yes, genioglossus. Lateral to it, inferior longitudinal muscle. Lateral to that, hyoglossus, and the lateral most will be styloglossus. Is that okay? Yes. So B is hyoglossus. D, this is the mylohyoid line from which the mylohyoid originates and inserts into the hyoid bone. Okay. Outer to that, you have the superficial part of the submandibular gland. Deep to that will be the deep part of the submandibular gland. Okay. So this is your lingual nerve, the submandibular duct. Okay. On the surface of the hyoglossus, we saw the hypoglossal nerve and the venae comitans. This will be the second part of the lingual artery. Superficial part of the submandibular gland, superficial relations of it will be the facial vein. This is the submandibular group of lymph nodes. This is the facial artery. Any idea what is C? That's the buccinator. So what is the answer to this question? The pointed structure, the inferior alveolar nerve innervates the mylohyoid, that is D. Okay, guys, are you okay with the muscle identification? Genioglossus, inferior longitudinal, hyoglossus, styloglossus. Mylohyoid, okay. Outer to that will be superficial part of the submandibular gland, deep to it, deep part. Yes. And the vessels and nerves that you see here, the submandibular duct is shown in green color. We saw how close the lingual nerve and submandibular duct are related. Okay, so this is the lingual nerve. The venae commitans accompanying the hypoglossal nerve. Any artery that you see deep to hyoglossus will be the second part of lingual artery. This is your facial vein, facial artery, submandibular lymph nodes. Okay. Yes, this is another question. Same thing. You can tell me the answers now. This is genioglossus, inferior longitudinal muscle, hyoglossus, styloglossus. What will be C? Below genioglossus, geniohyoid. Okay. Mylohyoid is also called diaphragma oris, right? So that is what you see here. This entire thing is mylohyoid or the diaphragma oris. Can you appreciate the submandibular gland, the superficial part and the deep part here? Okay. So what will be B? Anterior belly of digastric. What is A? Platysma. Okay. So muscles of tongue event, we saw 3 different images, right? So whatever image put, you should be able to identify the muscle. Then only you can talk about its nerve supply and action, right? Nerve supply to the pointed structure is from. So this question has been asked very recently, but on a histological image. Yes. Okay, very good. So this is the tip of the tongue, the base of the tongue. Okay. So here divided into anterior 2/3 and posterior 1/3 by sulcus terminalis. What is this depression that you see here? Foramen cecum, from which the thyroglossal duct begins, right? In front of the sulcus terminalis, these are the circumvallate papillae. Okay. Remember the von Ebner's gland, the serous gland opening into it, into the sulcus, bottom of the sulcus, it has the taste buds. And then these bigger ones, those are the fungiform papillae. The tinier dot ones, which are numerous, those will be filiform papillae. There's one more papillae, can you tell me? We saw circumvallate, fungiform, and filiform. These in the sides that you see here, these vertical mucous folds, those are the folate papillae. Now, taste buds are absent in which papillae? Taste buds are absent in filiform. Okay, in filiform papillae. Nerve supply to the tongue, all of you must be knowing. Anterior 2/3, general sensation, taste sensation. We divide it into 3 parts, right? Anterior 2/3, posterior 1/3, and posterior most. This is the anterior 2/3. The anterior 2/3 of the tongue, general sensation is by lingual nerve. The taste sensation from the anterior 2/3 of the tongue, except the circumvallate papillae, is by chorda tympani, that's a branch of facial nerve. The posterior 1/3. What does the posterior 1/3 contain? Can you tell me what are these? These are the lingual tonsil. The lingual tonsil part of the Waldeye's ring. Okay. This area, the posterior 1/3 is general sensation and taste sensation, along with the circumvallate papilla by 9th nerve. What do you mean by posterior most part of the tongue? The one that you see here, posterior most part of the tongue is nothing but, this is the epiglottis. Epiglottis, right? So the epiglottis is connected to the tongue by means of median glossoepiglottic fold, lateral glossoepiglottic fold. This depression on either side, this is the vallicula. Okay. What is this? This is the palatine tonsil in the lateral wall of the oropharynx. Can you identify what this muscle is? That's the palatoglossal arch, which has the palatoglossus muscle. This one here, this is the palatopharyngeal arch, which has the palatopharyngeus muscle. Okay. So when I say posterior most part of the tongue, it includes the vallicula. The lateral glossoepiglottic fold, it forms the superior boundary for your pyriform fossa. Okay. It is also called pharyngoepiglottic fold. Okay. It forms the superior boundary for pyriform fossa. So posterior most of the tongue includes the region of vallicula, the pyriform fossa, okay, and even the taste buds on the posterior surface of epiglottis, the soft palate, all of them are going to be supplied by internal laryngeal nerve. That's a branch of vagus. Okay, guys, we'll move on. Coming to the next question, identify the vagus nerve in the given image. Yes? Easy? Waiting for your answer? Very good. Okay. It's not at all difficult. So you see the carotid sheath here. Yes. What lies in the medialmost part of the carotid sheath? The common carotid, and high up we'll have the internal carotid. Lateralmost part will be internal jugular vein. Within the carotid sheath, between and behind will be the vagus nerve. So this image, the cross section of the transverse section of the head, neck region, yeah, this is very important. Okay. What are the other nerves that you see here? Okay. So we have sorted out vagus. B is vagus. What is A? Yes. Can you tell me what is A? Yeah. So this is the trachea. Yes, Vishnu, this is esophagus. In the tracheo-esophageal groove, we have the recurrent laryngeal nerve. Okay, right recurrent laryngeal nerve is given off in neck region. Left recurrent laryngeal nerve is given off in the thorax. Okay, make sure, remember that. C, what is C here? So behind the carotid sheath, posterior to the carotid sheath, we have the cervical part of sympathetic trunk. And D, what is D here? Yeah. No, it is not phrenic nerve. What could this be? It's just the ventral rami of your spinal nerve. There is phrenic nerve in this picture, but it's not labeled. I'll show you. Okay. So you have, okay. So you can identify the vagus within the carotid sheath. Behind the carotid sheath, cervical part of sympathetic trunk. In the tracheo-esophageal groove, recurrent laryngeal nerve. Now here, try to identify the muscles with me. Then I'll teach you two other nerves here. Can you tell me what is this muscle here? Immediately beneath the skin in the subcutaneous plane? Platysma, right? This one, sternocleidomastoid trapezius, which are enclosed within the investing layer of deep cervical fascia. The red color one that you see here, investing layer of deep cervical fascia. Now, coming to the strap muscles, the infrahyoid muscles. Can you tell me what is this on either side of the midline? Sternohyoid. Okay. Just lateral to that will be sternothyroid. I mean, it will be like inner to it. Okay. Sternohyoid superficially, deeper to it, sternothyroid. And lateral to this will be the omohyoid, superior belly of omohyoid. What you see here, blue color is the pretracheal fascia enclosing the lateral lobe and the isthmus of the thyroid gland. Can you make out the parathyroid here? That's the parathyroid. Okay. Now, yes, coming here. What is this muscle? This is longus colli. Okay. This one is scalenus anterior. This is scalenus medius. This is scalenus posterior. This is your levator scapulae. What is this area? This is the region of posterior triangle. Can you remember? Okay. So these muscles, they form the floor of the posterior triangle. Are you with me? Scalenus anterior, scalenus medius, scalenus posterior, levator scapulae, forming the floor of the posterior triangle. The floor is covered by the prevertebral layer of the deep cervical fascia. In the roof, we have the investing layer of deep cervical fascia. Now, where will the phrenic nerve be? Vishnu or Pavitra, whoever? So, where will the phrenic nerve you expect it to be? Yes, on the surface of anterior to scalenus anterior. This will be phrenic nerve. Got it, guys? Yes? If you get to see a nerve here in levator scapulae, running on the surface of levator scapulae, what will that be? Dorsal scapular nerve. If you get to see a nerve within trapezius, that will be spinal part of accessory nerve. Is that fine? Okay. So there are so many nerves in this picture. The recurrent laryngeal nerve, we'll just do the nerves alone now. Recurrent laryngeal nerve within the in the tracheoesophageal groove, within the carotid sheath, vagus nerve, behind the carotid sheath, sympathetic trunk, in front of scalenus anterior, phrenic nerve, between scalenus anterior and scalenus medius. Remember, you get the trunks of the brachial plexus contributed by the ventral ramen. That's why we are not telling anything specifically, but non-specifically as ventral rami of the spinal nerve. Okay, ventral rami of the spinal nerve. Within the levator scapulae, dorsal scapular nerve. Within the trapezius, spinal part of accessory nerve. So a minimum of 8 nerves can be marked in this picture, right? The same thing but with colorful, okay? Recurrent laryngeal, vagus, cervical part of the sympathetic. Now you can tell me phrenic nerve, right? Scalenus anterior, phrenic nerve is here. Ventral rami of the spinal nerve, dorsal scapular nerve, spinal accessory. Happy? Okay. So vagus, you know, it's also called the wandering nerve because of its long course, head, neck, thorax, abdomen. It's the longest cranial nerve. Remember this as mnemonic for the nuclei related to vagus. Nucleus ambiguous, giving rise to the special visceral efferent fibers that are going to supply the muscles derived from the pharyngeal arch, 4th and 6th. Nucleus ambiguous. Okay. Then the dorsal nucleus of vagus, the general visceral efferent fibers, the preganglionic parasympathetic fibers. Okay, one question which has been repeatedly asked. Can any one of you tell me which is the what are the cranial nerves that carries preganglionic parasympathetic fibers? Cranial nerves with parasympathetic component. Come on, please. In your chat box. Very good. It should be at the tip of your fingers. Okay, very good, Vishnu. 3, 7, 9, 10. Okay. So the dorsal nucleus of vagus, the general visceral efferent fibers to supply the GIT up to midgut, the respiratory tract, okay, the heart, all that, and even the viscera, the afferent sensation from the viscera. T for tractus solitorius. Just now we saw, right? The posterior most part of the tongue, the taste sensation is by vagus. Okay. Special visceral afferent. Tractus solitorius. And lastly, any idea what is this S for? Spinal nucleus of trigeminal nerve. Okay. So there's only one cutaneous branch of vagus. Can you tell me the only cutaneous branch of vagus is the auricular branch, that is also called Alderman's nerve, that supplies the concha of the ear, the pain, the thermal sensation from the concha of the ear. Okay. So this is the only cutaneous branch of vagus. So the branches from the vagus and just the cervical region I'm discussing. It gives off the meningeal branch. It gives off the auricular branch, the Alderman's nerve. And third, it gives off the pharyngeal branch. The pharyngeal branch of vagus, it joins with 9th nerve, the cervical sympathetic fibers, and goes on to supply the soft palate, pharynx. Okay. And then the superior laryngeal nerve. The superior laryngeal branch of vagus is going to divide into external laryngeal nerve. The external laryngeal nerve, it accompanies which artery? It accompanies the superior thyroid artery. Okay, it innervates which muscle? Cricothyroid. The cricothyroid is the tensor of vocal cord. Lesion of external laryngeal nerve will lead to a weak husky voice. Okay. And then the superior laryngeal, the other branches, internal laryngeal nerve. The internal laryngeal nerve, it pierces the thyrohyoid membrane that you see here. The thyrohyoid membrane accompanied by superior laryngeal vessels. And importantly, this internal laryngeal nerve is the content of pyriform fossa. It is entirely sensory. It supplies the mucosa of larynx above the level of vocal fold. Okay. Yes. Then it will give the vagus will give the cervical cardiac branches contributing to the cardiac plexus. And lastly, most important, it gives rise to the right recurrent laryngeal nerve. What does the recurrent laryngeal nerve do? It supplies all the muscles of larynx except, yes, come on, tell me, except the cricothyroid. And it supplies the mucosa of larynx below the level of vocal fold, vocal cords. So unilateral paralysis, okay, abduction will be lost. Bilateral paralysis can lead to dyspnea. And this one thing I forgot to tell you in that picture, okay, this one, yeah, that we missed out here. The anterior wall of the carotid sheath can be related to a nerve plexus, ansa cervicalis, okay. So this has been asked frequently, just a few minutes on ansa cervicalis. So the ansa cervicalis, it lies on the anterior wall of carotid sheath. Its formation, it has a superior root carrying C1 fibers. It is also called the descendants hypoglossite. It has the inferior root carrying fibers from C to C3. That's also called the descendants cervicalis. The superior root of ansa supplies superior belly of omohyoid. From the loop of the ansa cervicalis, superior root supplies the superior belly of omohyoid. From the loop, the branches will go to inferior belly of omohyoid, sternohyoid, sternothyroid. Okay. The C1 fibers, which goes along the hypoglossal nerve, is distributed to geniohyoid and thyrohyoid. This has been frequently asked. Okay, make sure you remember it. The branch from the superior root, from the loop, and exclusively the C1 fibers. Next question. The dangerous area of the neck is marked by, yes, which one? Answer, please. So what is A? A is superficial space, subcutaneous space. B is pretracheal space. C lies immediately behind that green line. That's the retropharyngeal space. And D, okay, between the dark orange and the light orange, that's the danger space of neck. Okay. So this picture also we have seen. The red one is the investing layer of the deep cervical fascia. The blue one is the pretracheal fascia. Okay, danger space of neck, option D. The blue one here is the pretracheal fascia. Okay, the orange one that here is the prevertebral fascia. The green line that you see here is the buccopharyngeal fascia. Right? So this space, what happens, this prevertebral fascia divides into an anterior layer and a posterior layer. The anterior layer is called the alar fascia. So the space between the buccopharyngeal fascia and the alar fascia is called the retropharyngeal space. Okay, because this is your pharynx. The constrictor muscle of the pharynx are covered on the outer aspect by buccopharyngeal fascia. So this excuse me. So the space that lies outside the buccopharyngeal fascia, between the buccopharyngeal fascia anteriorly and the alar fascia posterior, is called the retropharyngeal space. Behind that, between the anterior layer and the posterior layer of the prevertebral fascia, This is the danger space of neck. Why so? Because, excuse me, the danger space of the neck, as I told you, anteriorly bounded by buccopharyngeal fascia that covers the constrictor muscles of pharynx. Posteriorly by the anterior layer of prevertebral fascia called the alar fascia. Above base of skull. Below, what happens? Okay, since it's going to cover the anterior surface of the vertebra, the body of the vertebra, it goes all the way down up to the diaphragm. Okay, it extends down to the posterior mediastinum, which has the important blood vessels of the thorax. Okay, so that's why it's called the danger space of neck. The retropharyngeal space, guys, I'm sorry here, just anteriorly, the danger space of neck is bounded by the alar fascia, posteriorly by the prevertebral fascia. Excuse me. Now write it, okay? Above base of skull, below posterior mediastinum. Talking about the retropharyngeal space, anteriorly bounded by buccopharyngeal fascia, posteriorly alar fascia. Now, important, the lateral boundary for the retropharyngeal space, you can tell me, is formed by the carotid sheath. Carotid sheath with its contents. Okay. Above again the base of skull. Below, okay, the retropharyngeal space goes up to T4. Superior mediastinum. Right? Okay. There's one more space. Parapharyngeal space or the lateral pharyngeal space. Okay. Above again base of skull. Below it goes as far as the hyoid bone. Okay. Medially, it will be related to the retropharyngeal space. Laterally, it will be related to the parotid gland, the medial pterygoid muscle. Okay. Posteriorly, is a styloid group of muscles. It has the maxillary nerve, vessels, all that. Importance of this space is that, okay, remember the palatine tonsil lies in the lateral wall of the oropharynx. Any infection of the palatine tonsil, it can track on to the parapharyngeal space. Any abscess over the retropharyngeal space, it will produce a paramedian swelling. Okay. Coming to the next question, which nerve is thickened in the following image of patient with Hansen's disease? Can you tell me the answer, please? Very good, Pavitra. Yes, yes, Kartika. So the nerve that is pointed out here, the thickened one here is great auricular nerve coming from cervical plexus with a root value C2, C3. Okay. A quick revision. Excuse me. A quick revision about the posterior triangle of the neck. It is bounded anteriorly by posterior border of sternocleidomastoid. Posteriorly by anterior border of trapezius. Apex is by the superior nuchal line where both these meet. And the base is by the middle third of the clavicle. Right? Can you identify, what lies in the roof of the triangle? Skin, superficial fascia, platysma, investing layer of the deep cervical fascia. The roof in the lower part will be pierced by external jugular vein. Now identify the muscles that forms the floor. So this is your scalenus anterior. Okay. This yellow that you see here between scalenus anterior and scalenus medius will be the brachial plexus. So this is scalenus medius, scalenus posterior, levator scapulae, splenius capitis. High up, okay, vertical fibers will be semi-spinalis capitis. The inferior belly of omohyoid will divide the triangle into two parts. the upper occipital triangle and the lower subclavian or supraclavicular triangle. Okay. Now, can you identify the contents of occipital triangle here? So the highest content that you see here, this one will be spinal accessory nerve. Hooking around it and going upwards, this will be lesser occipital nerve. This one going towards the auricle, yes, that's the greater auricular nerve. Okay. This one running across the sternocleidomastoid, the transverse cervical cutaneous nerve. And these are the supraclavicular nerves. Okay. So apart from that, we'll also get to see the dorsal scapular nerve. Okay, the dorsal scapular artery there. This is the external jugular vein, right? So drooping of shoulder results from injury to spinal accessory nerve. Right, very good, Muttarasi. Now coming to the subclavian triangle, the floor of the subclavian triangle is formed by the inner border of the first rib, the first digitation of serratus anterior. Okay, so can you identify the structures here? This is scalenus medius, scalenus anterior, the trunks of brachial plexus. This blue color one is the subclavian vein. Can one of you tell me the tributaries of subclavian vein? Yeah. External jugular vein, anterior jugular vein. Okay. The superficial cervical vein. Okay. The suprascapular. Now, this is the subclavian artery. The subclavian artery is divided into three parts by scalenus anterior muscle. Okay. So what will be the contents of subclavian triangle? Subclavian vein. The third part of subclavian artery. What is the branch coming from the third part of subclavian artery? Is we see here? The dorsal scapular artery. What is the branch coming from the first part? Vertebral artery. VIT, right? Internal thoracic artery. And the thyrocervical trunk that will give rise to suprascapular artery, inferior thyroid artery, superficial cervical artery. Okay. So here in the image, this one which follows the inner border of the clavicle, this will be the suprascapular artery. This will be the transverse cervical artery. Okay. Deeper here, this will be the vertebral artery. This will be the inferior thyroid artery. Okay, guys. Then the upper trunk, the middle trunk, the lower trunk of the brachial plexus, and the supraclavicular part of the brachial plexus, the branches from the root, the dorsal scapular nerve, the long thoracic nerve, accessory branch to phrenic nerve, branch from Erb's point. What are they? Nerve 2, subclavius, suprascapular nerve. All these will be contents of the subclavian triangle, right? We'll move on. Identify the nerve which causes the injury to which causes lateral gaze palsy. Come on. Waiting for your answers. Easy? Yes, very good, Kartika. Okay. So what you see here is the picture of cavernous sinus. Okay. So the cavernous sinus lies on either side of the body of the sphenoid. The roof and the lateral wall is formed by the meningeal layer of dura mater. The medial wall and the floor is formed by the endosteal layer. If someone asks you, what is the content of cavernous sinus? What will you tell? What is the content of cavernous sinus? Yes, please, expecting your answer. What is the content of, no. What is the content of superior sagittal sinus? What is the content of inferior sagittal sinus? It has venous blood, right? The content of cavernous sinus is venous blood. Whatever structure that you see here, they lie outside the endothelium. Okay, they're just the relation of cavernous sinus. Okay, please remember all the structures that you see here in the lateral wall and the floor, they lie outside the endothelium of cavernous sinus. Don't go with the picture. Okay, so in the floor of the cavernous sinus, you get to see the internal carotid artery. Inferolateral to it, that will be the abducent nerve. Injury to the abducent nerve will cause difficulty in abduction of the eyeball, right? And in the lateral wall of cavernous sinus, outside the endothelium of cavernous sinus, we'll get to see, yes, what are the nerves there? The one topmost will be oculomotor nerve. Below that, trochlear nerve, and below that, ophthalmic division of trigeminal nerve. Okay, this one lower down is maxillary division of trigeminal nerve, but this has been removed from the textbooks, but not from the pictures seen in Google. Okay, maxillary division of trigeminal nerve has been removed as a content from the lateral wall of cavernous sinus years back. Okay, as I told in the beginning of the session even, like there'll be definitely one question on extraocular muscle palsy, right? The following picture exhibit which cranial nerve palsy? So this is the right eye, this is the left eye. Which eye is normal? The right eye is able to see up, see out, and see in. But here the problem is with the left eye. The patient is not able to abduct his left eye. Again, injury to the abducent nerve. Okay. So we know that the extraocular muscles, what are they? Superior rectus, inferior rectus, medial rectus, lateral rectus, superior oblique, inferior oblique. Don't forget the levator palpebrae superioris. Okay. Yeah. So nerve supply to these muscles, I'm sure all of you will be very familiar. Superior oblique is by trochlear nerve. Lateral rectus is abducent nerve. Yes, all the others, levator palpebrae superioris, medial rectus, inferior oblique, and plus two more. What are they? Anyone? Ciliaris and yes, sphincter pupillae, supplied by the third nerve. Am I right? Okay. Now you should be able to tell the action of these muscles. Easiest we'll finish first. Medial rectus is going to cause adduction of eyeball. Lateral rectus will cause abduction of eyeball. Right? The superior rectus will cause elevation of the eyeball. Inferior rectus depression of the eyeball. But the obliques, since they are inserted behind the equator, superior oblique will cause depression. Inferior oblique will cause elevation. Okay. Now the other actions related to these four muscles, remember the mnemonic. The recti will adduct. The obliques will abduct. The superiors intort. The inferiors extort. Right? So if I ask you, what are the actions of superior rectus? What will you tell me? Elevation of eyeball, adduction of eyeball, okay, intorsion. Okay. If I ask you superior oblique, depression, abduction, yes, intorsion. Okay, guys. Now we'll go to identifying these muscles. Can I rub it? Erase it? Okay, come on. Identify with me the muscles that. Remember, there are 4 walls, right, for the orbit. Superior, inferior, medial, and lateral. All the 4 walls, okay, all of the 4 walls, 3 walls will be related to two muscles each. Only the lateral wall, you get to see a single muscle. Okay, the muscle on the lateral wall is lateral rectus. So this is a superior view. Okay, superior view. Yeah, and here this is again the lateral rectus. What do you see on the superior aspect? Immediately as you open the roof of the orbit, the muscle that you come across will be levator palpebrae superioris. Okay, levator palpebrae superioris. Only when the levator palpebrae superioris is cut, you'll get to see the superior rectus. Okay, the superior rectus. So the 2 muscle on the superior wall will be the roof of the orbit will be levator palpebrae superioris, and underneath it will be superior rectus. Coming to the medial wall, there's an important clue in the medial wall. What is it? To identify it as medial wall. The pulley, the trochlea there. What is the muscle winding around the trochlea or the pulley? The superior oblique. Okay. So on the medial wall, superior aspect, what you get to see will be superior oblique. Underneath, if you lift the superior oblique, underneath, you'll get to see the medial rectus. Can you identify the superior oblique there? Beneath it will be the medial. Can you see here the medial rectus here? Coming to the floor of the orbit, okay, which is visible here. This is inferior rectus. Originating from the floor of the orbit, from the maxilla, this will be inferior oblique. Okay, got it? Now in this picture, tell me, waiting for your answers. The same recti and the oblique muscle, but you should be able to identify in this image. Paralysis of the pointed structure will lead to. Very good, Priyadashni. Yes, okay. So we'll see the muscles here. Before that, I'll show you this picture here. As I told you, this will be in the roof of the orbit. Levator palpebrae superioris. What lies underneath it? Superior rectus. Medial wall, you can see winding around the trochlea, superior oblique. The one below that, this is medial rectus. Lateral wall, only one muscle, lateral rectus. In the floor will be inferior rectus, below will be inferior oblique. Okay, same thing here, see here. So medial wall, superior oblique above, medial rectus below. Roof, levator palpebrae superioris, superior rectus. Below, inferior rectus, inferior oblique. Lateral wall, lateral rectus. Is that clear? Now we'll go back to the question again. So here, lateral wall, only one muscle, lateral rectus, right? Medial wall, the one above will be superior oblique, the one below will be medial rectus. Here, floor, inferior rectus, inferior oblique. In the roof, one above will be levator palpebrae superioris, and just below that will be superior rectus. So the one pointed out in this picture is levator palpebrae superioris supplied by oculomotor nerve, injury to which causes ptosis. Okay, because that's the only elevator of the upper eyelid. Is that clear? Okay. Now, can you identify what is the nerve injured here? This is the trochlear nerve palsy. What is the position of the eyeball? It is turned upward and inward. The patient is not able to turn his eyeball downward and laterally. Okay, we know that the action of trochlear nerve supplies superior oblique. Just now we saw, right, the actions of superior oblique: abduction, intorsion, and depression. So the patient will not be able to look downwards and laterally, will have vertical diplopia, will have difficulty while walking downstairs, okay? And will present with a head tilt. Yes, come on, tell me, what is the nerve injured here? So this is the right eye, this is the left eye. What is evident in the left eye? Ptosis, can you appreciate ptosis? Okay, the nerve injured is oculomotor nerve. So the mnemonic for oculomotor nerve palsy, the features are ptosis, external due to paralysis of levator palpebrae superioris, external strabismus, unable to, when you try to look medially, the eyeball, yeah, it moves laterally. This is due to paralysis of your medial rectus. Okay. And then dilated and fixed pupil. Why? Because of loss of innervation to sphincter pupillae. And apparent accommodation reflex is lost. Accommodation reflex is lost, okay, due to paralysis of ciliaris muscle. Okay, there'll be an apparent proptosis. Okay, loss of accommodation reflex. Okay, ptosis, external strabismus, dilated and fixed pupil, apparent proptosis, loss of accommodation reflex. Okay, coming to the next question. Identify the muscle which depress the mandible. Waiting for your answer. Very good, easy. Now come on, tell me, what is A? What is A? There's a clue to it. You see a green structure piercing it. This is the parotid duct. So what is A? A is buccinator. Okay. B, easy, lateral pterygoid. C, inserting into the inner surface of the ramus of the mandible, medial pterygoid. Can one of you tell me what is D? D. What is D? Can you make out this structure here, this white line here? That is the pterygomandibular raphe. From the anterior aspect of the pterygomandibular raphe will be the origin of buccinator. From the posterior surface of it will give rise to superior constrictor. Remember in the tongue muscle diagram we saw superior constrictor. The superior constrictor, okay, understand the relation between buccinator and superior constrictor, okay. The pterygomandibular raphe, anterior aspect of it will give rise to buccinator. It's a very nice picture to show that, okay. And the posterior aspect of it will give rise to superior constrictor muscle of pharynx, okay. So yes, what are the four muscles of mastication? Lateral pterygoid, medial pterygoid, masseter, and temporalis. Why they are called lateral pterygoid and medial pterygoid? In relation to what? Both these muscles originate from lateral pterygoid plate. But what is the difference? Lateral pterygoid muscle will originate from lateral surface of lateral pterygoid plate. Medial pterygoid muscle will originate from medial surface of lateral pterygoid plate. Lateral pterygoid plate, as you see here, it inserts into the capsule and the articular disc of temporomandibular joint, okay? And of the four muscles, that's the only one which causes depression of the mandible to open the mouth, okay? Medial pterygoid, where does it insert? You see the ramus of the mandible here. So if this is the ramus of the mandible, inner aspect of the ramus will receive the insertion of medial pterygoid. Someone asked masseter. Where will you look for masseter? On the outer aspect of the ramus, okay? Yeah. So ramus of the mandible, inner aspect, medial pterygoid, outer aspect, masseter, okay? And temporalis from the temporal fossa, inserting into coronoid process of mandible. Okay, similar thing. Which muscle helps in opening of jaw? Easy. Here again, you're going to see the muscles of mastication, but like another section, coronal section. Waiting for your answer. T. Very good, Vishnu Bala. Yes. So we'll try to read this image, okay? So starting from here, this will be the median longitudinal fissure which lodges the fox cerebri. Can you make out the corpus callosum there? This is septum pellucidum. This will be the lateral ventricle. This will be part of your caudate nucleus. Okay, yeah. Now coming to this area, can you see here? This one. This is the sphenoidal sinus. Okay. Then here, this is the soft palate. I'm sorry. That's the roof of your nasal cavity. Wait. I'll repeat it, guys. Wait. So here, sphenoidal sinus, no confusion. This is the soft palate. So what you see is your soft palate. What you see above that will be the nasal cavity. This is the oral cavity. Okay. Now here, this muscle that you see here will be the lateral pterygoid. Lateral pterygoid. Okay. This one here, this and this, that's the medial pterygoid. Okay. This will be the fibers coming from the temporal fossa to the coronoid process of mandible. That will be temporalis. Can you identify the masseter here? Can you make out the margins of the mandible here? Outer surface of the ramus of the mandible, that's the masseter. So if you get to see any nerve vessel within the mandible, ramus of the mandible, what will that be? The inferior alveolar vessels and nerve. Is that okay? Now coming to the muscles of the tongue that you can see in this picture, can you tell me? So the substance of the muscles of the tongue is formed by genioglossus. Okay. Then this will be your hyoglossus. This will be mylohyoid. Okay. This will be geniohyoid. This is your submandibular gland. Superior longitudinal, inferior longitudinal. This, yeah. Is that fine, guys? Any doubt in this picture? Let me know. Okay. So muscles of mastication, you should be familiar with these two diagrams, these two pictures. You want me to repeat it or it's okay? Okay. Lateral pterygoid, medial pterygoid, temporalis, masseter. Right. Abduction of vocal cord is done by easy. So this also has been asked repeatedly in your exams. Okay, we'll do it. The answer is A. Yeah, so most of you getting it wrong. You should be able to understand this picture. Can you tell me what is this cartilage? Thyroid cartilage. This one lower down. This one. The only one cartilage that forms a complete ring around the cavity of larynx. Cricoid. This one here, that's the arytenoid. Right? Okay. Now this muscle here, okay, this is your vocal cord, right? Can you identify the vocal cord here? Vocal cord. Just immediately lateral to the vocal cord, this muscle that you see here will be vocalis muscle. And just lateral to that will be thyroarytenoid muscle. Is that fine? No confusion with these three: vocal cord, vocalis, and thyroarytenoid. Okay. Now I told you this is the arytenoid cartilage. On the posterior surface of the arytenoid, you see a transverse muscle running here. That will be transverse arytenoid. What is special about transverse arytenoid? The transverse arytenoid is the, yes, come on, tell me. Transverse arytenoid is the only unpaired intrinsic muscle of larynx. Okay. And crossing it like this will be your oblique arytenoids. Okay. Now, this is the lateral process of the arytenoid. Inserting anteriorly into it will be lateral cricoarytenoid. Posteriorly into it will be posterior cricoarytenoid. I'll repeat it again with another image. So in these three images, you should be able to identify the thyroid cartilage. This is your thyroid cartilage. This is your thyroid cartilage. This is your thyroid cartilage. Can you make out the cricoid? Here, this will be your arytenoid sitting on top of the others. Okay, arytenoid. Here, again, this is the cricoid. This is arytenoid. Here, you know, right? Arytenoid and cricoid. What is this cartilage? That's the epiglottis. So what is this muscle which lies on in the fold of the aryepiglottic fold? Aryepiglotticus muscle. What is the action of aryepiglotticus muscle? The contraction of aryepiglotticus of both the sides will close the laryngeal inlet. Okay, easy to identify, right? Aryepiglotticus muscle. This is your thyroid. This is epiglottis. From the thyroid to the epiglottis will be thyroepiglotticus muscle. These fibers. Okay, from the thyroid to the arytenoid, these fibers will be thyroarytenoid muscle. Okay, so these things you can see clearly here. The same thing here, this is your cricoid I told you. On the posterior surface of cricoid will be posterior cricoarytenoid. Posterior surface of the arytenoid will be transverse arytenoid. And posterior to the transverse arytenoid, this one crossing over will be oblique arytenoid muscle. If you trace the oblique arytenoid up, what is it going to continue as? As the aryepiglotticus. Got it? Okay. The same thing only we are seeing here. This is your cricothyroid which is cut off. The lateral process of arytenoid anteriorly receives the lateral cricoarytenoid, posteriorly posterior cricoarytenoid. Okay. Guys, since it's important, I'll just repeat it again. You repeat it with me, okay? What is this muscle here? Aryepiglotticus. This one, thyroepiglotticus. This one, thyroarytenoid. This is lateral cricoarytenoid. This will be posterior cricoarytenoid. This is cricothyroid. Okay. So in our question, vocal cord, ocalis, thyroarytenoid. This is your cricothyroid. Okay. Lateral cricoarytenoid, posterior cricoarytenoid. As I told you, transverse arytenoid is the only unpaired intrinsic muscle. Cricothyroid, what is the action? It's the tensor of vocal cord. Posterior cricoarytenoid is the only abductor of the larynx. Okay. Ocalis and thyroarytenoid will be relaxer of the vocal cord. The transverse arytenoid, oblique arytenoid, all those will adduct the vocal cords. Is that okay? And we have seen already all the muscles of larynx are supplied by recurrent laryngeal nerve, except cricothyroid that's going to be supplied by external laryngeal nerve. Fine. The probe space receives the opening of, come on, waiting for your answer. Yes, answer please. What is the probe space? The arrow is above the middle meatus, so it should be into the superior meatus. The superior meatus receives the opening of posterior ethmoidal sinus. Okay, the inferior meatus is this space, middle meatus is this, superior meatus is this. Sphenoethmoidal recess will be in front of your sphenoidal sinus. Inferior meatus receives the opening of nasolacrimal duct. Middle meatus, maxillary sinus. Then you have the hiatus into which the anterior ethmoidal sinus will open. On the surface of the bulla will be middle ethmoidal, and high up frontal sinus. Okay. 4 structures opening into middle meatus. Superior meatus will receive the opening of posterior ethmoidal. Sphenoethmoidal recess will receive the opening of sphenoidal sinus. Is that okay? Yeah, the last one here, the probe space transmits. Easy? Previous slide. The probed space transmits. Very good, very good. So what is a probe space? It is foramen ovale that transmits the male structures. Mandibular nerve, accessory meningeal artery, lesser petrosal nerve, and emissary vein. Right? Okay. So foramen and skull, it's inevitable. You should definitely know that. In the middle cranial fossa, can you identify these foramen here? So this is foramen ovale. Next to it will be foramen spinosum. What does the foramen spinosum transmit? Middle meningeal artery and nervous spinosum. And here in front, it is seen better here, this one. This is the foramen rotundum. What passes through foramen rotundum? Maxillary nerve. Okay. This is the internal acoustic meatus, which transmits the 7th nerve, 8th nerve, and labyrinthine artery there. Jugular foramen, yes. The anterior part of the jugular foramen transmits the inferior petrosal sinus. The intermediate compartment, 9th, 10th, and 11th cranial nerve. The posterior most compartment, where the sigmoid sinus is going to continue as internal jugular vein. Okay. So we'll start our questioning session now. Okay, ready on your buzzer? Can you tell me which of the muscle mark divides the lingual artery into 3 parts? Yes, hyoglossus. Okay, we have done enough discussion on this. Yeah. All are false about the marked structure except what is the marked structure? Recurrent laryngeal nerve. They ask what is the true statement about recurrent laryngeal nerve, right? It winds around the 3rd part of subclavian artery. No, the right recurrent laryngeal nerve winds around the 1st part of subclavian artery. It pierces the thyrohyoid membrane. No, the internal laryngeal nerve pierces the thyrohyoid membrane. It accompanies the superior thyroid artery. No, superior thyroid artery is accompanied by external laryngeal nerve. It supplies the mucosa of the larynx below the level of vocal cords. Yes. All are modifications of the marked layer of deep cervical fascia except. So, yeah. Answer, please. So, what is the marked layer? Prevertebral layer of deep cervical fascia. This prevertebral layer of the deep cervical fascia divides into 2 layers, right? Anterior layer and posterior layer. The anterior layer is called alar fascia. This prevertebral fascia, it covers the muscles of the posterior triangle. What is there in the posterior triangle? The subclavian vein, artery, brachial plexus. So it continues as a covering for these axillary artery and the brachial plexus as axillary sheath. Okay. Of course, it contributes to the carotid sheath. The buccopharyngeal fascia is not a modification of prevertebral fascia. It covers the outer surface of the constrictor muscles of pharynx. The pointed structure in a way in ENT, they might have taught you, right? Isn't it? Any syringing procedure in the ear, yeah? Bradycardia, because just now we saw auricular branch of vagus, Alderman's nerve, which part of the external ear it supplies? Concha is supplied by Alderman's nerve. Alderman's nerve is the auricular branch of vagus. The pointed structure here is great auricular nerve, right? Why is it called great auricular nerve? It's going to supply greater part of the auricle. Okay, auricle, if you see this anterior part, we call it as lateral surface. Behind, we call it as cranial surface. The great auricular nerve, it supplies entire part of the cranial surface, posterior part of the lateral surface, including the region of lobule, the helix, antihelix. Okay, this concha is supplied by 10th nerve. Remember, the auricular temporal nerve runs in front of your auricle. That supplies the crus of the helix and the tragus region. Okay, guys, we'll move on. The pointed structure exits cranial cavity through answer, please. Very good. Prakal, yeah. The answer, the pointed structure is maxillary nerve. I told you it has been exited out of content of lateral wall of cavernous sinus, which passes through the foramen rotundum into the pterygopalatine fossa. The pointed structure causes very good elevation of mandible. The nerve involved in the palsy shown in the given image supplies which of the following muscle? That's the third nerve. And the answer is very good, very good, very good. A hearty clap to each one of you. Okay. So third nerve, remember it's levator palpebrae superioris, superior rectus, inferior rectus, medial rectus, inferior oblique. Do not forget the ciliaris and one more, sphincter pupillae, right? External laryngeal nerve supplies. Very good. Okay, by now you must be thorough. Okay. The pointed structure drains into frontal sinus, the anterior end, the superior end of hiatus semilunaris of middle meatus. The last question for today's session, not this arrow, okay, this one. The dural venous sinus passing through the probe spaces. Very good, very good, very good, okay. The inferior petrosal sinus, which is the first tributary of internal jugular vein. Guys, hope today's session was useful. Any doubt, get back to me. Thank you. We'll wind up the session. Have a great day.